What's up, y'all? Welcome to the Sports Medicine Broadcast, a podcast to and improve your practice as an athletic trainer. I am Jeremy Jackson, host of the Sports Medicine Broadcast, and this one is sportsmedicinebroadcast.com/cognitive FX. Cognitive FX. And so Dr. Alina Fong is a specialist. She's been working with MRIs, and I have to go through and read because a lot of big words here. So she's a distinguished clinical neuropsychologist, an award-winning expert in traumatic brain injury, board member of the U.S. Brain Injury Alliance. And so there's a whole lot of stuff. There's a stuff in her bio. It's a lot of really cool, really big, really important stuff. And so I really want to know how this can impact the high school athlete. So, but before we get there, we'll kind of explain what cognitive FX is. So, Dr. Alina Fong, welcome to the Sports Medicine Broadcast.
Thank you so much, Jeremy. It's a pleasure to be here.
All right, so let's get right to it. Can you give us the overview so we have an idea, define what is cognitive FX?
Sure. So, Cognitive FX is a specialty concussion traumatic brain injury clinic that I founded here in Utah almost 15 years ago. And we are a very special clinic because we are one of a kind. We are what we call a direct specialty care clinic. So we have patients that are referred to us from doctors here in Utah, and patients that maybe find us organically and online when they are running out of options to treat their traumatic brain injuries, specifically concussions or, long haul COVID and some of these more frustrating invisible injuries that you as athletic trainers see and that we see as specialists here. But part of the reason that we're really, really different, Jeremy, is that we specialize in a type of functional neuroimaging. So we specialize in a type of advanced neuroimaging called functional MRI. And so I know that all the AT athletic trainers out there are very familiar with regular structural imaging like CT and MRI, right? But fMRI is very different because even though you use the same scanner, the process by which we do the scan and the information that we get is so vastly different and so much more informative for our concussion patients. So that's one of the biggest reasons why CFX is so different. The second reason is because athletic trainers are so integral to our treatment team, but they are 1/15 of our treatment team. So we have a really, really large, multidisciplinary, interconnected treatment team. And I can go into more detail on that if you want to, but that's another big reason. And the third reason is that we have a very um, intense approach, an active approach to therapy. Rather than maybe one or two appointments for an hour a week, we have an 8-hour a day program for 2 weeks. So this is a very intensive program, and patients come here from all over the world just to really get a good diagnostic workup and then get a very targeted treatment plan.
Right. So one of the questions I did have was, what role does the athletic trainer play? And let's go ahead and cover that one, and then I'm going to go back to the 8 hours a day, session. So what does it look like? So let's go with the athletic trainer first. What role does the athletic trainer play in cognitive FX and in as part of your staff?
So as of right now, I believe we have at least 3 athletic trainers. And I'll tell you, you guys aren't that easy to find. I'm glad that I'm doing this because part of this is that, I mean, I've gone to the NATA, and there are times when I'm like, gosh, we really need to hire an athletic trainer. And you guys are not that easy to find, I'll be honest. So I'm glad that I can just kind of present what we do here and introduce myself to your network, because we're always looking for very motivated, talented athletic trainers that we then train. Okay, so here's the role that an athletic trainer has in our clinic, but we train them to understand more in depth what functional MRI is, how to understand how the brain connects to the body, and we look at neurointegration, we look at cranial nerves, and we teach our athletic trainers even more about that brain body connection. But we use a lot of an AT's tools with regards to body mechanics and injuries, because most of the patients that we see are between the ages of 18 and 40, and so many of them are injured doing like doing sports, right? Whether it's skiing or athletics, other types of like school athletics, high school, professional. But then we have the everyday person that is, getting injured from slipping and falling on ice too. So we just have a wide range of expectations for an athletic trainer, but a lot of specialized training that we do connecting the brain to the body.
Okay, so let's follow that just a little bit. Your ideal athletic trainer candidate that you're looking for, there's people that listen to this, or I'll share it online. And so if you're putting out your little sales pitch for the athletic trainer to apply, what is it? Are you looking for someone with 7 years, someone that has college experience, someone that's worked with the Olympics? What are you looking for specifically?
We look for someone that is willing to learn. Um, we have actually athletic trainers that are right out of school and some that have been doing this for like 20 years, and the most important thing for us is someone that is always curious and willing to always learn something new because the brain and when we deal with concussions, Jeremy, the brain is really the one organ in the body that we still don't know everything about. We know how a bone's going to heal, right? We know what makes the heart pump, okay? But we are still not quite sure how the brain really works and how the brain really heals and why some people struggle with concussion symptoms for decades. Why do some people recover very quickly? It's still an exciting science. And so we really the quality that we're looking for is someone that is very curious and is trainable and wants to learn, new information and new science about the brain. I don't care how much experience you have, honestly.
Fantastic. So we were talking about the 8-hour treatment thing, and one of the things I was reading through on your website, it says each patient will have a different outcome because each concussion is different. And so I've been here. We were partner, or one of our local hospitals, I'm sorry, is Memorial Hermann, and so we have Doctor Summer Ott, and she's one of the concussion experts, and she's always said, if you've seen one concussion, you've seen one concussion.
Okay.
Yeah, and so they're not all the same. Throw everybody in the same box, and so I love that, that's included there and saying, "Hey, this treatment has shown this results over time and in this large group of people, but everybody's different." So with that being
Absolutely.
said, you have it says Epic Treatment. So I've got a link to it in the show notes, and you could go to cognitivefx.com and find any of the information that we're talking about here. But tell me, what does that look like? Because if you're saying 8 hours a day, do I have to like fly to Utah and then I stay in this like a hotel room? Do I stay, is there a camp there? What does that look like?
So, yes, yes, and yes. So our clinic is in Utah, and like I said, we have people from all over the world that come, and I'm not kidding. In fact, when I was just looking at my patients this morning when we were doing rounds, we have 3 patients this week from the Netherlands. We have 2 patients this week from Canada, and then the rest are from the United States, but all over the United States. And we have 2 patients from Utah this week. So we have about 15 patients this week, and we have about that much every week. So imagine we are a clinic that caters to 15 patients that are here for 2 solid weeks back to back most of the time. Now, these patients fly in and they start with that initial functional MRI piece. Now, I have to kind of back up to that because I can't talk about the epic treatment without talking about the scan. So, this scan is so different, Jeremy, because rather than just getting a static image of your brain, which for a concussion, as you know, most MRIs come out completely normal, right? Okay. So I was really frustrated with this because I had patients coming to me saying, "Hey, I know there's something wrong, but my CT looks normal, my structural MRI looks normal, but I know that there's something wrong." So, when I actually started to do fMRI and my graduate schooling was all in fMRI and advanced neuroimaging, I thought we need to develop a test that can pick up on these injuries and these issues when other imaging looks normal. So functional MRI is you're using a regular MRI, but you're actually lying down in the MRI machine doing neuropsychological cognitive tasks while you're in the MRI machine. So rather than just looking at structure and making sure the occipital lobe is there and the temporal lobes are there and there's no bleeding or skull fracturing, actually having them do tasks because what the fMRI picks up are the subtle neurometabolic changes that happen in the brain after swelling and inflammation. Okay. So, as you know, with a concussion, that head gets hit, brain gets shaken, and there might be areas of contusion and inflammation. Well, even normal MRI may not be able to pick that up. But when you test drive the brain after a concussion and you say, hey, do these hard things, that's when we start to see, wow, this brain is not firing well. Why are some parts of the brain working exponentially harder, metabolizing more, and compensating for these other areas that were knocked out during the concussion? So that is what an fMRI clearly shows, is this energy inefficiency that happens after these injuries. So when each patient gets their scan, you can imagine that each of their scans look very different because we're looking at almost 60 different regions of the brain, and we're looking at how those regions are metabolizing oxygen, okay, which is the main energy metabolite in the brain. And so when we can see, wow, this area, your posterior anterior cingulate is sorry, your posterior cingulate is absolutely hyperactivated, and your occipital regions are very hypoactivated. That is a very different treatment plan from someone that might have the opposite finding. And that's why we need a very intensive 2-week program. Okay, so now let's talk about an 8-hour a day program. So patients come here and they are seeing a number of different specialists. So remember when I said that ATCs were like 1/15 of my team?
Mhm.
All right. So we have MD, my partner is an MD neurosurgeon. We have MD neuroradiologists. We have PhD neuropsychologists like myself and PhD neuroscientists. We have PhD clinical psychologists for the psychological aspect, which is very common, right, with long-standing concussion issues. But then we have neuromuscular therapists, physical therapists. We have a doctorate in physical therapy here as well. Then we have our athletic trainers. Then we have our neurointegration specialists, our occupational therapists, our speech language pathologists, our cognitive therapists, our vestibular therapists, our vision therapists, and so on. I know I'm leaving some out, but imagine that each patient for 8 hours a day gets one-on-one 30-minute to hour-long sessions with each of these different disciplines, and we have numerous therapists in each discipline. So it is a very comprehensive care. And I know that might seem like, how in the heck can a patient do that? But by the time they come to us, we know exactly how to work with them, and we make sure that we keep them with the right energy levels to be able to do this for 8 hours a day for 2 weeks.
Okay, so one of the reasons that, like, this was so appealing to me, doing this podcast is I have a family member was a high school soccer player, sustained a concussion, so I don't have all the details, or I don't even have the details about what the treatments they've gone through, but, mom is a medical professional, and so they're not poor, so it wasn't a lack of money that they couldn't fix the concussion, but, that was about I would guess 8 years ago, the concussion happened. Now, that family member is in college and still has balance issues, like, has trouble carrying a tray from the cafeteria to the table to sit and eat because of just random balance issues. And so is there any sort of, like, statute of limitations for cognitive effects?
That is a great question, Jeremy. And I'm glad that you're bringing up these personal stories like this, because when you have listeners, especially athletic trainers that are paying attention to this, everybody knows at least 5 people that have had a concussion that have had lingering symptoms, right? I mean, you guys are on the front lines of this. We're on the front lines of this. Um, we know that, yes, some people get better, but I can assure you that you could probably name 5 people that are like, hey, you have not been the same since your concussion, but they look normal, right? That's the problem, is that these patients don't, they're not missing an eye, they're not missing an arm. They look like everybody else, and so they kind of get ignored. I'm here to tell you that there's no statute of limitations on how plastic your brain can be. We have had patients that have been injured, 3 months after their injury. We have patients that have been injured 3 decades. That come to us 3 decades after their injury, and they can still see improvement. Now, obviously, the younger you are, the more plastic your brain is, the closer you are to your injury, the better. But we still have seen huge improvements even decades later.
In decades later? Is That's good. I'm going to be emailing them right after this and say, "Hey, just check this out." So, Sorry, I kind of jumped ahead. I'm really interested. So when they come for the 8 hour treatments, is this a like a facility where they stay sleep there on site, or do they have a hotel or like Airbnb, whatever it is, they stay somewhere else and then come for 8 hours and then go back to their hotel?
Yeah, I'm sorry. I totally forgot to answer that part of your question. That was my fault. So we have like a partnership with a Marriott hotel, which is very close to our clinic. And again, we've been in business almost 15 years, and so this hotel is very grateful for us because even during COVID, right when everything was shut down, our patients were still coming. And so and because they come from all over the world, we have to get a good partnership. So it's a nice little Marriott. They have a little shuttle that brings the patients to and from the hotel to the clinic. And but there are some people that say, I think I'd rather just do an Airbnb, and they can do that as well. But we try to make it as easy for these patients as possible because of how rigorous the therapy is.
Gotcha. Very good. Right. And then listed on the website, there's the prices. There's the price for the scan only, the price for the 1 week, and the price for the 2 week session. And that's amazing because so many times you see that that's hidden, like, oh, well, call us for the cost, call us, this kind of thing. And it's right there. And it is not cheap. Like, I think for the 1 week, it's like 24,000. And then for the 2 week is like 34,000, something along those lines. Those numbers could be wrong just off the top of my head. But when you're thinking about what you're doing, you said you got 8 hours a day. You probably got at least eight specialists that you're dealing with for eight
Yes.
hours. You got the functional MRI at the beginning and functional MRI at the end. Uh, and you're really focused on getting there. And like you said, at this point, these people are almost hopeless. Like, I'm not going to get better. And so, um, one of the things that it also mentions is that y'all have the CPT codes that you can submit to insurance. And so I'm just curious, is it usually successful in submitting like insurance reimbursement or something like that?
Yes. So each individual plan is different. We actually have a list of different insurance companies and what they typically reimburse. Of course, it's up to whatever person happens to be your caseworker, right? I mean, we all know how insurance works, but on average, we're looking at anywhere from 60 to 80% coverage, depending on your uh, insurance plan, of course. But the beauty of it is that because the therapies are therapies that someone can get, anywhere, like even where you're at, right? Um, the CPT codes for the therapy usually get reimbursed no problem. The scans, however, those are still some insurance companies will reimburse for those, and some say, no. Why do you need 4 MRI scans in a week? That seems excessive. So what happens is we do a functional MRI at the beginning. We do a functional MRI at the end, but then we also do a brain structural MRI and a neck structural MRI. So, we are just data driven practitioners, right? I don't want to guess. I don't want to wonder if there's, cervical spine issues because honestly, with a concussion in the sports world, there's almost always a neck related issue if you get a head injury, right? I mean, we see it. We don't want to ignore the neck. And so typically insurance companies say there's no reason you should have 4 MRI scans within 2 weeks. That seems excessive. So they may not cover all of the MRI scans. But the therapies are so widely accepted that most of the time those do get covered. I do want to just clarify real quick. So most patients come for 2 weeks, and Jeremy, that is the 24,700 price. If you were to just do 1 week, it's a $13,000 price. But I'm glad, your audience that's listening to this, you're all in the medical field. You know how expensive these scans are, and you know how expensive it is to do 8 hours of therapy a day. And when you do that for Monday through Friday and then another Monday through Friday, it starts making sense. Like, oh, okay, this is where these costs are coming from. We are so attentive to these patients. And the reason why a lot of so the ATCs that we have stay with us for a long time, and it's all of our therapists stay with us because we're not governed by insurance. Insurance isn't dictating to me, Jeremy, how long I have to sit with that patient. I can sit with that patient for more than 7 minutes, right? If they need me for an hour, I will sit with them for an hour. I will, commiserate with them if I need to. I can go do deep dive with them into their medical history. If you say to me, Hey doc, I've been working with this patient, looking at their MRI scans. I think they need a bit more of this. Can we get, they need more, athletic training appointments or more neuromuscular therapy appointments. I say done because we can do whatever's best for that patient based on this non-insurance model.
Yeah, it really is like if once we discuss all the details, that's 8 hours, so many therapists, because a normal physical therapy is gonna be once a week for 6 months, right? But here we are, like, so intense. So, yes, those 4 MRIs are crushed down into that thing, but then I also love that it's not like, "Okay, well, we're gonna try this for a week." I mean, so many times in my practice, in my athletic training clinic, "Alright, hey, your low back is hurting? Okay, well, we're gonna do these stretches and these exercises for 2 weeks. If we don't have an improvement, then we're gonna send you to the doctor." Well, I'm seeing them every day, but for 40 minutes, an hour, that kind of thing. And then so many times I see like, well, why does that professional athlete recover from ACL surgery in 6 months? Because they have a team of people working for multiple hours a day to get them better. And then it's just taking that same concept and putting it into the concussion. So I love the idea.
Yeah, exactly. You have it exactly right. I mean, think about all of these, elite athletes. And, fortunately, I don't know if you read this, but um, what's kind of unusual about our clinic is that our first clinic was not actually here in Utah. The first clinic we ever opened was in partnership with Tom Brady. So Tom and his best friend, who's a trainer, and us, we opened up TB12 Sports Therapy and Concussion Clinic in Foxborough. And so that was really an experience. So, we were fortunate enough to really treat a lot of professional athletes, and we still do now. But you know, uh, everyone gets concussions, right? Not just NFL football players, but we really had a great opportunity in the beginning to work with some of the best athletes. And I'm telling you, these guys, with the right care. I don't know. I mean, you've probably seen this too, where some people just seem a little superhuman, and that's why they're, elite level athletes. They just heal differently. It's beautiful, but they have a team around them that's catered to them like 1,000% all the time. I wanted to provide that for everyone. I want everyone to feel like their brain can change if given that special attention, and that's what they have here.
All right, good. So Kayla, I know you weren't ready for this. So there she's kinda, putting the idea out there, like, we're looking for an athletic trainer. So as a first year MAT student, what is gonna really pique your interest to apply and work with Dr. Fong?
I would have to say the mentorship. I know you talked about it, but as me being in my first year, my second year and graduating terrifies me, especially because now the master's program is 2 years. So having someone that can mentor you and is there to work with you and help you grow and learn, I feel like that is a really big thing that would appeal to a lot of new graduates. Also, having a support system. The AT world is very small, and when you know someone that knows someone, it makes life just a little bit easier going to places that you haven't really been before. So I feel like those are the two things that really would like spark my eyes. Also, seeing someone that's passionate about what they do. Everyone said like that gets into athletic training gets into it for the passion. So working with someone that is also equally passionate about what they're doing really makes a difference.
That's wonderful. And I have to say, one of the things that I want to be very, very open and honest about is, um, here at the clinic, because we're not specifically a sports medicine clinic, we do have some applicants that come in and they tour the clinic and they're like, "Oh, this is great," but they realize, "But wait, is your average patient an athlete or a high school athlete?" And I'll say, you know, um, they usually get injured while doing athletics, but that doesn't necessarily mean that they're, we're not doing a lot of taping of ankles and wrists and things like that. We are very neck, spine, kind of brain focused. And so one of the things I just want to be very open about is, we some of the feedback we've gotten from some athletic trainers is like, "Oh, you don't do as much of the sports side that I got trained on." And I said, "Yeah, you're absolutely right. We don't do that. We are really a specialty clinic. that wants to take all the skills you learned in your athletic training and apply it to the human body, but also get a foundation of how the brain is the central organ and how, the nervous system and everything really um, works together and can affect the whole when there is a brain injury.
Yeah, so I love the fact that, like you said, there is that training piece. Like we bring you in, we train you, we teach you what you need to know. You don't
Mhm.
have to come in with preset knowledge. You can come in with a little experience or no experience or a lot of experience. But then again, it is for that specific athletic trainer that enjoys a concussion, enjoys being in that office, is adaptable to working with the non-athletic. Like I've always said, for me as an athletic trainer, I love that I go out and shoot hoops as part of my rehab program. That I'm out there at the game. I'm on the sidelines with the team, and that for me, that's a big part of why I do athletic training.
Mhm.
So making the switch to the clinic, to the concussion focus, to the, maybe the 7-year-old that stepped on ice, like you said, whatever it is, it would be difficult for me, but for some athletic trainers, that's going to be just the perfect fit. And so I would definitely encourage anyone interested to at least reach out to Dr. Fong.
Well, thank you, Jeremy.
And then, so I feel like we covered functional MRI and what it does. And we talked about the Epic, the 8 hours, you're staying in a hotel, you're there for 8 hours working with a specialist. I would like to hear just an interesting case study or story, to kind of wrap us up.
Oh, wow. Okay. How do I choose? We have I'll tell you one more recently, and this kind of gives you an idea of how broad our patients are. So I'd say about 70% of our patients are concussions. Okay. So that's still our bread and butter. But I'd say about 20% are what we call our COVID long haulers. Okay. So we're looking at patients that have had maybe a viral infection or even not just COVID, but maybe encephalitis or meningitis. But then we also have a smaller group, about 5%, that are stroke or seizure disorder. So, we are quite broad in our diagnostic categories just because of my background, right? As a neuropsychologist, and I see all brain injury. But one of my favorite patients, and I'll say this just because we just heard from her recently, but she had like an insider edition story on her, and I will tell you her name because it's out there and she's fine with it. But her name is Riley Horner, Riley Horner, Horner. And there was this big article, I mean, it was on the news and everything about this young girl who was very young at the time she came to us that had a traumatic brain injury, but then was kind of like the 51st dates, like she kept forgetting. Her day kept resetting and resetting and resetting. And they reached out to us completely organically and just said, look, we're still looking for help. What can we do? We brought her into the clinic. She was with us for 2 solid weeks, and we saw huge improvements in her functioning. Now, she wasn't 100% fixed, and like if anyone guarantees that, you better run, right? But she saw significant improvements. She came back again after a few years, just for another kind of a reset and touch up, because she was a teenager when she came to us, and as we know, the brain changes and develops over time. She came back in. We scanned her again. We saw her again, and we saw huge improvements again. Well, now she's a young girl in her early 20s, and she reached out to us just in the last month, Jeremy. And I might get a little teary talking about it, but she literally wrote to us saying, I just want you to know that I just graduated from nursing school. And this is someone who couldn't remember what she had for breakfast that day. And just to hear from her mother as well, who wrote us saying, thank you so much for getting her daughter back and allowing her to just allowing us to be a part of this healing process for her, to get to the point where she was so inspired that she now wants to be that she's a nurse and she wants to help other people improve. I love this story because if you saw go and watch the inside edition on her, and to know what she came from that to now she's a nurse. This is why I do what I do, and this is why we all do what we do, right? In healthcare.
Mm. That's really funny that you said 51st dates because it immediately gives me a picture of what's going on. It's such a like improbable situation, but then, man, graduating from nursing school after something like that, that's really cool.
Yeah. It's incredible. She is incredible.
All right, Kayla, any other questions for Dr. Alina Fong?
I don't think so. I just have a note. Spread the word about your clinic to younger athletic trainers. Don't be afraid to reach out to programs because I know so many of my classmates that would be interested in talking with you or just picking your brain about getting into a research side or a non-sport side of athletic training because there are a lot of us that are interested in it.
That warms my heart. Thank you. And Jeremy, I'm so glad that we have this connection now, because what I want to make sure is the next time we do need someone, I will just go to immediately to you and say, "Hey, do you mind, maybe putting it on up on your, on your kind of influencer boards and seeing if anyone might be interested?" Because I'm on. I'll be totally honest. It's not that easy. Just so you know, we have had quite a few of our therapists that have moved from out of state to Utah for our clinic and for our therapists. If you are good, we want you. I don't care where you live. We will do whatever we can to get you here if you are wonderful and if our patients love you. So, thank you so much for spreading the word that way too.
Fantastic. Cognitive FX. So if you just Google that, if you do cognitivefx.com, you can Google Dr. Alina Fong, any of those. But what is your preferred way for people to reach out and get a hold of you?
Yeah, so our website is cognitivefxusa.com. And right there, I mean, you can call me into my clinic. My contact information is on there. That is probably the best way to get in touch with me. And then we're also on Instagram. Cognitive Effects is on Instagram, and we have a great marketing team that fields all of those DMs. And so, any way you want to follow me, you can follow me. On my CFX Instagram, my personal Instagram is on there. If you want to DM me, I check those pretty regularly as well.
Fantastic. Miss Kayla Jean.
My email is kjrazo@cougarnet.uh.edu.
There you go. You remembered it this time. Of course, anybody listening to the podcast knows how to get a hold of me, Mr. Jeremy Jackson, or the Sports Medicine Broadcast on Instagram is probably where I am most often. But you can also go to sportsmedicinebroadcast.com. This one specifically will be sportsmedicinebroadcast.com/cognitivefx. And I'm really looking forward to sharing this with my family member and just seeing, hey, can this help you? And going from there. And then that would be so cool if we followed up, if they were able to, if it works out, if they're able to go, and if that would just lots of ideas going through the head. So, Dr. Lena Fong, thank you so much for joining us here on the Sports Medicine Broadcast.
My pleasure. Thank you.
All right. So for Jeremy, Dr. Fong, Kayla, and the Sports Medicine Broadcast, Landa Martinez from the PHS Eagle Media Broadcasting booth. Thank you for all the work you do over here, Landon. That is a wrap.